Okay, thank you for that introduction. I'm a postdoctoral research fellow at Trobe University, and I just wanted to start by saying thank you to the Congress organisers and the panel conveners for having me here to speak today. This is, I think, the largest room I've ever presented to, so please bear with me if I'm a little nervous. Okay, here we go. So as we all know, autism is characterised by remarkable heterogeneity, and there is a large degree of individual differences evident in the symptoms and skills that individuals with autism present with, as well as their developmental trajectories, so their outcomes over time, and in their responses to specific intervention programs. We say that on average, early intervention provides positive outcomes for many children with autism, but within that, there is a large degree of individual differences, and there are some children who show limited or less gains across the course of an intervention program. Most research focuses on whether a particular intervention approach works in general, so that's looking at average change over time, and we can miss a lot of the individual variation that's evident within those groups. And less is known about the factors that are associated with individual responses to early intervention programs. We don't yet know enough to be able to predict positive outcomes in response to early intervention programs. Some of the factors that are consistently raised or identified in the literature include younger child age at intake to a program, the amount of intervention or the dose of intervention that's received, as well as symptom severity, so the amount and type of symptoms that children present with, and their developmental level at intake. But often when we measure things like symptom severity and developmental, we use total scores. And really that can tell us, I think, limited information at times, because a very different or very varied combination of skills can contribute to the same total score in these measures. So it can mask the role of specific skills and behaviours that are really important to understand clinically so that we can tailor our intervention programs appropriately. So the aim of this study was to look at individual differences in developmental gains across a cohort of children receiving early intervention, and to identify the specific behaviours at intake that are associated with the degree of developmental gains made across 1 year of early intervention. The cohort included 131 children with autism, the majority of whom were boys, as we would expect, and were aged between 1 and 5 years when commencing the early intervention program. Today we're looking at the ADOS, which was completed at entry to the program, and gains are measured according to the Mullen scales of early learning, which was completed at entry and exit. All of the children in this cohort were receiving the Group Early Start Denver model, which has been manualised by Vivanti et al., and were enrolled for an average of 3 days in this program across approximately 10-month periods. So that's a calendar year. To quickly look at the group level differences that we see across the program, we're looking here at age equivalent gains in the domains of the Mullen, and we're seeing significant gains across each of the domains, with the highest level of gains in receptive language and more limited gains in fine motor skills in this cohort. But what constitutes meaningful individual change? As researchers, we're pretty good at looking at group-level differences and determining when an effect is statistically or meaningfully different, but that can be hard to determine at an individual level. One approach to this is by calculating a reliable change index. So this is a statistical approach for determining meaningful change at an individual level. We calculate this by first of all looking at a change score, so that's the difference between scores at exit and intake, and looking at that in relation to the standard error of the difference. So all you need to know about the standard error of the difference is that it incorporates the normal variation that we would expect to see in a population, as well as the test-retest reliability of the measure. So it's incorporating some variation that we would normally see in a normally distribution, as well as measurement error as well. So we were able to transform our age equivalent scores into a standardised reliable change index score. So this allows us to look at where an individual is at in relative to the normal population and what we would expect of change over time. So here, if we're looking at a RCI, or a reliable change index score between -1 and 1, that would suggest no reliable change over time. An RCI between 1 and 2 would suggest some possible improvement, but we can't be sure that this is not due to chance or due to measurement error, where a significant improvement is indicated with RCIs greater than 2 or greater than 1.96 for those familiar with Z scores. So here when we look at our population, we can see that approximately 1/3 of the children were classified as having no reliable change, so that's the RCI score between -1 and 1. About 1/3 of the population are again coming up as having possible improvement, so a score between 1 and 2. A further third, but then classified as having significant improvement. So this is an RCI score of higher than 1.96. Now this figure here is really, again, to highlight the degree of individual variation that we see in this young cohort of children receiving early intervention. And so we've got verbal and non-verbal age equivalent scores and highlighted the degree of discrepancy that we're seeing across the whole cohort and still within those individual change categories. So the group who's showing no reliable change in verbal and non-verbal scores here are showing improvements of 1 to 2 months across the year of intervention, where those who are showing significant improvements are showing gains in excess of 12, 15 and 20 months for the exceptional improvement group. We've then looked at distinguishing what distinguishes those children who make no reliable change versus those who make significant gains over time. And looking at the demographic and the characteristics of the children in these groups, there are no meaningful differences in terms of those child characteristics. The one thing that comes out as again significant is the ADOS calibrated severity score and the Mullen developmental quotient scores. So these total scores are significantly different between those who show significant gains over time and those who show no reliable change over time. But again, we want to dive further into these measures to see if we can identify specific behaviours that we can identify at intake that may suggest a more improved developmental trajectory. So we've then conducted a series of hierarchical regression models looking at age at intake, developmental skills at intake, the amount of intervention that the child has received, as well as specific behaviours that are measured by the ADOS. And we've included here items that were common across modules toddler 1 and 2, and those that measure a specific behaviour rather than a summary item. So this first regression model, we're predicting verbal DQ scores at exit, again looking at the role of specific behaviours as measured by the ADOS. The first behaviour that comes up is response to joint attention. And here the size of the circles is meant to roughly indicate the size of the effect in the final model. The second behaviour that comes up is pointing. So a child who is showing more developed response to joint attention skills and more developed pointing skills when they enter the intervention program are showing higher verbal skills at exit. Younger child age is again coming up as a significant predictor, as well as the language as measured by the ADOS, and response to name. And when response to name enters into this model, pointing is no longer significantly contributing above and beyond these other factors. And the final factor there is overactivity. So a child who is showing less overactivity when commencing the intervention program are then showing more gains over time. So this final model accounted for 68% of variance in the verbal skills at exit. We've then conducted or rerun a similar model, but this time controlling for verbal skills at intake as well, because we would expect, as I said, the test-retest reliability of these measures is approximately 70 to 80%, so we would expect high relationship between these factors. Response to joint attention, younger child age and overactivity and showing continue to provide significant unique contribution above and beyond the effect of verbal skills at entry, where language, pointing and response to name are no longer significant in this model. So the variance that they had contributed is now brought into or absorbed by the fact of verbal skills at entry. And this final model accounted for 78% of the variance in DQ at exit. Looking then at non-verbal skills quickly, we can see that pointing, overactivity again, younger child age, language, response to name, functional play, and when functional play comes into the model, pointing is no longer significant, and showing, again, are significant unique predictors of verbal skills at exit. This initial model counted for 56% of variance. When we conduct the model again, but controlling for nonverbal skills at intake, we can see that response to joint attention and pretend play are the factors that are contributing uniquely to our outcome measure, where child age, response to name, language, overactivity, showing, and functional play, the variance that they had contributed is now absorbed within the nonverbal DQ at intake. And I think what really stands out from these regression models for me is the degree to which the factors are similar in the prediction of nonverbal skills and verbal skills as well. So we're seeing a lot of the same things come up again. So to quickly summarise here, the types of behaviours that we're seeing at intake as being predictive of outcomes over time include first looking at where the child is at. So that's really looking at their developmental level and chronological age. The second type of group of behaviours that we're seeing often come up is those tuning in type behaviours. So this is really looking at how a child responds to the social overtures of another person. So this is response to joint attention, response to name. Overactivity is also included here as a punitive predictor, meaning that it's influencing the degree to which an individual can attend and engage in learning activities. And the third group of symptoms or skills that we're seeing here are those related to engaging others. So pointing, showing, language, and play. So these are the types of specific skills and behaviours that we can look for at intake that might suggest the developmental trajectory or learning trajectory that we can expect across a year of early intervention. I'd like to thank, again, everybody for attending, the families who generously participate in our research, the large group of collaborators who contribute to this body of work, and our funders, the Australian Government Department of Social Services. Thank you.
Thank you very much, Catherine. It was a very interesting talk that shows that the heterogeneity of developmental trajectories and tries to define predictors of positive outcomes. Is there any questions? Yes.
Thank you for the very impressive talk. Just wondering, if we look at some particular child, we want to know not predictors of the good outcomes. We want to know how to tailor a program for this particular child. How your answers help this particular child at the moment.
That's a really good question, thank you, and I wish I had lots more time to talk about this as well. But I think that, so the types of factors that we're identifying here can be used to inform proximal intervention targets, or in terms of these, the types of behaviours that we can work on first before moving on to other skills. And in terms of the intervention program here that we're working with, which is the Group Early Start Denver model, it can indicate children who might be more, it might be more appropriate to go into the decision tree at an earlier point in time of that intervention program, rather than continuing for a series of goals, so 3 months. We might say, this is a child who will deal with, or who would benefit from that more substantial input at an earlier point. Is that helpful?
Is there another question?
Thank you again, and apologies if I speak really quickly.